Hello, and welcome to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelly. Today, I have expert Leslie Logan, a Pilates expert, and she is the co-founder of online PilatesClasses.com. She has taught thousands of students, trained hundreds of teachers, and led workshops at global conferences and supported companies such as the Associated Press and Balanced Body, empowering their participants with movements and happiness through Pilates. Now, I will tell you, I have some patients and some clients where they just can't go out to walk. They can't necessarily do the high impact exercises. And the one thing I tell them is that, hey, have you considered Pilates? Have you considered this therapy to kind of help us feel moving more and also strengthening your core, strengthening your body? And so when I heard about Dr. Leslie, I knew I had to have her on the podcast to teach us all the things about Pilates. So welcome to the podcast today, Leslie.
Oh, I'm so happy. Thank you. Thank you so much for the work that you do promoting Pilates. I mean, it really makes me so happy. Usually I'm coming on to tell people how great Pilates is, but you already know. We can tell the listeners how it is. But I also, yes, you guys, core strength is so key. Sometimes the high impact stuff isn't even an option because we don't have the strength of our center to hold us up and take on the impact of those moves. And, you know, just because you're doing low impact doesn't mean it's like low results or low benefits, you know?
Exactly. You can get so much from low impact exercise. Well, before we get started, tell us a little bit more about yourself. How did you get into this space of Pilates?
Oh my gosh. So I love telling the story. I used to be embarrassed to tell the story, but I love it because hopefully your listeners can resonate. When I was invited to my first Pilates class, I actually rolled my eyes. I thought it was like a BS workout, like infomercial workout, couldn't do the things it said it could do, but I wanted a friend. So I went to class and actually, I felt parts of my body I never felt before. And I like left the class so excited about the day. I had just so much energy and I was like, oh my gosh, I'm going to do this every single day. So I changed my work schedule so I could. And the more I did it, the more I got to know myself even more because you get to pause all the chaos in your brain and just focus on what you're doing in that moment and have a movement meditation with yourself. And I realized I didn't love my job or where I lived. And so I moved. And then I became a Pilates instructor and I happened to live down the street from one of Joe Supply's clients and I got to study with him and his proteges and they became my mentors. And I started traveling the world because I was just so passionate about it. And now I've taught people of all walks of life, all different ages, from 11 to 85 and beyond. So it's really a blessing really to be able to teach it because I get to help people live the life that they want to live.
Oh, that's amazing. Well, thank you so much for sharing. So for somebody who's heard of Pilates, but doesn't quite know exactly what it is, how would you describe Pilates?
Yeah, it's a great question. So Pilates to me is a strength-based workout that is designed to balance your imbalances. And that means that you are going to get flexibility from Pilates, but it's not just a stretch work and it's not just a strength work. So if you go to the weight training, for example, that is pure strength. Yoga could be strength, but often people use it for stretch, right? Whereas Pilates is going to be the balance of both. If you are very, very strong, we're going to work on flexibility with you, and that's how the exercise will affect you. And if you are needing strength, you're going to get strength out of it. And if you need both, then you're in the best place because you need both things. But it is designed to work the entire body from the center first. So we don't spot train in Pilates. We actually work everything about connecting the muscles in your center. And your center is basically, think about your torso. It's for anything that surrounds your pelvis to your shoulder girdle and the things in between. So that's your back, your front, your sides. And if we can stabilize your spine, stabilize your axial skeleton, then we get to challenge you by moving your arms and your legs around and see if you can keep those connections.
Oh, great. So Pilates is the best of both worlds.
Yes.
You have flexibility and you have strength.
Yes.
Which is important because that's what people need. They need to have that strength to tighten up their muscles, tone up their muscles, as well as the flexibility.
100%. And also, like, injuries happen when you are too tight. They happen, and that can be, you could be super strong and tight, you could be super weak and tight, but tightness is actually where things get torn but then if you're too flexible, then you can have injuries because you fall on a joint or you're not staying inside the muscle. So we need both things to prevent injury and have longevity in our life.
Awesome. Well, what are some of the benefits of Pilates? I know you mentioned the core strength. Is there anything else?
Oh my gosh. Okay. The sky's the limit, but the benefits are going to be amazing posture, right? So core strength is going to be how posture happens. You shouldn't have to think about your posture. Your body should just do it. And when you have good posture, guess what? You have reduced injuries, but also amazing digestion. It also reduces stress. Yes, you guys, if you have poor posture, you also are going to have not so great digestion. You're going around looking for like different pills and things like that. But really, you just need to give room for your guts. You will have reduced stress, mental clarity. You have better lung capacity because you're learning how to breathe and move. We're not holding our breath at any time. You flexibility in the muscles and also around the joints. There are moves that actually teach you how to get up and down off the ground, which is what's going to increase the length of your life and the quality of the life that you live. There's so many more things we can go into, but spinal health is a big one. Joseph Pilates said, you're only as old as your spine is young. And there's a lot of young people with very stiff spines. And then there's also like really like people in their 80s and 90s with young spines, and they are more youthful because our spines need to have mobility and flexibility so that they can take on all that life asks us to do.
That's important. I never thought about that. You're only as young as your spine.
Yes.
Because I see patients where their spine, like they may be in their 30s or 40s, but they have bulging discs. Like it's a lot.
Yes.
Does Pilates help with any type of like medical condition? I know you mentioned it helps with stress, but is there somebody who's like a good candidate who should be considering Pilates in their daily routine?
Yeah. So if you have any aches, pains, or injuries, you've been cleared to move, but you're kind of like a little unsure. So Pilates can, especially private sessions. I would not send you to a class if you are someone who's coming out of an injury or working with a new to you condition. I would first work with private sessions because Pilates really does meet you where you are, and there's different pieces of equipment that we can use to help work the rest of your body out. So if you have knee or hip replacements, once you've been cleared to move, Pilates is going to be one of the best places for you to go to learn how to move your body in a balanced way. But if you have neurological conditions, Pilates can be one of the best things that you can do because there's a lot of stuff that we do lying down. There are Pilates instructors, not myself, but there are Pilates instructors who are trained to work with Parkinson's and other types of conditions to help people, especially with the balance part of their body and moving, things like that. I personally had a tibial plateau fracture and it was non-surgical, but I couldn't put weight on it for 8 weeks. And Pilates was the only things I could do because there's a ton of exercises that do put weight on the leg, but there's also a bunch that don't. And so I could literally just remove the ones I couldn't do and I could still have a movement practice. You can do it as a pre-postnatal person. And do it prenatal. I've had clients do it up until the time they gave birth. Depends, every pregnancy is different. However, I certainly encourage you to start Pilates before you're pregnant. There are some qualified teachers who can work with a person who is pregnant in a one-on-one capacity if they've not done Pilates before, but it's better for you, the person who's going through the pregnancy, to start Pilates beforehand, because then you'll know what feels different to you. As a teacher, we're not in your body. So yeah, there's so many different things that you can do. And I think that's what's really great about Pilates is it really does meet you where you are with the different conditions that can be there. I've worked with people who have had heart conditions and things like that, where a lot of things they couldn't do. MS. We can keep the room really cool and actually move your body at the pace that works for you. Some conditions, I'm going to say, most conditions, they start with privates first, just so that you can learn the moves for your body before you go into a group class. But then back issues, fusions, stenosis, Pilates can work around those conditions.
Oh, wow. Okay. Well, that's great. Seems like everybody can benefit from Pilates.
Yeah, I really can. I mean, like I said, I work with 11-year-olds to help them work on their coordination, and they were getting tall so quickly. They were 5, 6, and 11 years old. So we were working on their core strength to help them with their posture, because nowadays, kids are on devices. Everyone's on devices. So you see all these forward heads going on. Here's the problem with forward head, guys. The more forward your head goes off your spine, the more that you see information or people coming towards you as a threat. You don't see it as helpful or just being part of society. The other thing about your head going forward on your body is it affects your posture, which you already know affects your digestion, but it affects your pelvic floor. So even though I'm not a pelvic floor therapist, I can see that if the more forward someone's head goes, the more likely they're going to have pelvic floor issues. And men listening, you have a pelvic floor too, you can have issues too.
It's not just ladies.
Yeah.
Well, is there anybody who should be avoiding Pilates?
Yes. So like I said, if you are currently pregnant and and you've never done it, I personally would, even if your doctor told you to do it, I would suggest waiting until afterwards. If you have rods in your spine, as opposed to just a fusion and in like one spot, I'm going to suggest that you really do work with a trained professional in Pilates who works with spinal conditions. Otherwise, it might not be the best thing for you because you can't flex, extend, or twist or side bend. So it can be limiting what you can have. Those would be my two tops. Then if you are currently in acute pain as opposed to chronic pain we can work around, but acute pain, anything going on with a herniation that just happened, you're going to want to wait to before you start something new, just because it's going to be hard to see, is the pain that you're feeling from your condition or is it from a new movement? It's really important as an instructor, if you tell me, here's the things that I currently have pain on, and then I can ask you, is this new or is this hard, right? There's a difference between hard and hurt, and we want hard is okay, hurt we don't want. So those are some things. But if you have any neurological conditions like water on the brain, there are teachers who are specialized in those things. Again, find teachers who are specialized. And to help you, you are looking for teachers who have at least been comprehensively trained. That word's very important. You'll hear comprehensively trained. You should be seeing more than 450 hours next to their certification. They should have been trained on multiple pieces of equipment. If you do have conditions that are more high risk, I want you to look for someone who has more specialized training. So they have all those things I said, plus they've been trained in things that you are working with. Someone who has severe scoliosis is going to want to work with someone who's worked with scoliosis before. So just keep that in mind. If you're a unique butterfly, find a teacher who's been trained to work with you or is willing to work with you. And don't go into a group setting if you're going through anything right now, just because it could set you up. It could set you up for a setback, and that's not what the teacher wants, and that's not what you want.
Oh yeah, I love that. I love that unique butterfly.
Yes. We all get to be unique, and some of us just are a little more delicate.
Yes. I like that. How does somebody get started? If they've never done Pilates, they're inspired by listening to you. They're like, let me try it. How do they get started?
I love this question. So if you are an able-bodied person, you got some aches and pains, but not really anything that's like medically you need to just get checked in, you can actually start Pilates online. You can do something. My Full Body in 15 workout series is it has a workshop that literally teaches you the exercises and then a 15-minute class. So you can do it on the floor at home on your own. Super awesome. fullbodyin15.com. We also have other free mat series because you just need room on the floor. If you are someone who's like, I prefer in person, Leslie, you sound amazing, but I just want to do in person. That's who I am. I need that. I totally understand. I'm not offended. You can actually look up Pilates near you. Again, you're going to want to look for things like comprehensively trained. And I do recommend going to a place where they expect you to do an intro session, a private session, or an intro series, or an intro class. If the place lets you, as a brand new person, just go into an equipment class, warning, red flags. They are there for having lots of people come through and not necessarily the impact on you. You want places that have rules like that actually care about the impact and the benefits you're going to have over their like bottom line. Of course, they need to make money. They're a business, but those rules are there for a reason. They're there to keep you safe. So that's what I would suggest doing.
Oh, awesome. Well, any last minute advice for those who are wanting to get started or those who maybe fell off from Pilates? Any inspiration you have?
Yeah. So first of all, just be kind to yourself. Okay. And also the thing that in-person offers you is the accountability and showing up in person, and having like someone's attention on you. But something about online that's really nice is that you don't have to finish the class. So if you are new to moving and new to getting started, you can press play and literally after 5 minutes, you can go, I'm done. And I did my Pilates today, and that's enough. And that's something that we talk about at onlinepilatesclasses.com. We're like, finishing is optional. The class is 30 minutes, but you never have to finish it. You could do the first 5, you do the first 10, so really being kind to yourself and being in practice. And I think Pilates is important to understand. Pilates is a practice, just like being a doctor is a practice. Like we are in practice. And when we're in practice, we get to be curious and we're not trying to be perfect about it. And so that means you get to fall off the wagon, you get to miss a couple of days, and you can pick back up where you left off.
I love it. Well, for those who may not have heard, how can somebody work with you?
Yeah. So onlinepilatesclasses.com is where I have free tutorials. It's where we have our online classes. It's in the name. And if you are wanting to check out some free content, free classes, you can go to opc.me/challenge. There's a free mat challenge in there. And I even think that the full body 15-minute class is also on that page. So you can pick the one that works best for you.
All right. Well, thank you so very much, Leslie, for telling us everything that we need to know, or at least to get started with Pilates.
Yeah, it gets started. Just get started.
That's right. Just take one step forward. Well, thank you all again for coming, and thank you all for joining us on the Back on Track Achieving Healthy Weight Loss podcast. If you like this episode, please share it with others, like it, and subscribe. And don't forget to leave a 5-star review. And we will see you all next time.